All right, so it's currently 10 p.m. Just got back from class. Woke up at 5 a.m. this morning, went to the gym, went straight to work at the hospital. I'm still in the same scrubs. I worked at the hospital as a physical therapy technician from 8 a.m. to actually that's a lie, 7:30 a.m. to around 4ish. From there, I went to class, got there an hour early, prepared for class, had the class, ended up having another class, and then had another class online. Um, so that's my average day, honestly. And I'm just gonna be going off the top of my head. Didn't prepare for this whatsoever. Um, I'm just working with the time that I have. Because after this, I still have to work on two other research projects, um, study for exams, whatnot, prepare for tomorrow, do it all over again. So my name is Alan Benavides. I am currently a junior. I will be a senior by the end of the semester, I believe so, or categorized as a senior. Um, I'm 20 years old. I was born here in the Valley. I was born in Edinburgh, Texas. However, although it may not look like it, I am Hispanic. Yo hablo español. Um, my parents are from Mexico, China, Nuevo León, and General Bravo. So yeah, I'm pretty much an undercover cop. Just kidding. Much like Dr. Benavides, actually, from what I can see, I'm not 100% sure as to what he looks like. I have yet to meet him in person, but we are both Benavides, so it's pretty funny. Um, what else can I give you for background info? Oh, okay, so I work as a physical therapy technician at South Texas Health System. So today I was actually at the McAllen Medical location. It's the level 1 trauma center. Usually, most of the time, though, I am in Edinburgh in the level 3 trauma center off of Trenton. And I mean, I love it, man. I love everything to do with physical therapy. I actually have also another job. I work at Milestones. It's a pediatric clinic. This pediatric clinic mainly it has some young adults in there as well with you know um, they're limited to their cognitive they're limited in their cognitive capacity due to certain conditions. There are some patients with cerebral palsy as well. You name it, man. Like any sort of condition that any child may need therapy for. Milestones has speech, OT, and PT. I'm there for PT. I work as a rehab technician there as well. And well, obviously at the hospital, things are a lot different than pediatrics. We do have some pediatrics. I'm not usually on the pediatric side. I'm in acute all of the time. However, some days I do step into the inpatient rehab. In my opinion, I do enjoy the inpatient rehab a little bit better than um, the acute section, just because you do get to work with the patients a little bit more, and actually rehab them. Whereas in acute, whereas in acute, um, the patients most of the time they're of older age with and they're in pretty severe condition, whether it be accidents, like motor vehicle accidents, falls. Falls is a very big one we get most of the time, uh, as it's very common in old age, whether it be because of metabolic conditions, or just lack of activity from a very sedentary lifestyle. These patients can develop sarcopenia, whether it's again metabolically, or due to inactivity, leading to uh, chances of low bone mineral density, which can then induce osteopenia and osteoporosis, which increases the chance of a fracture in these patients. And a lot of the time, that's what we see. We see hip dislocations, femur fractures, broken ulnas, broken radiuses, dislocated shoulders. Haven't seen a fractured femur yet. I mean, humerus yet, but we do have other things as well, like you know, slipped discs that they're there for. Um, you know, but a lot of the patients also come in for other comorbidities and more severe chronic and endocrine conditions like diabetes, and then obviously obesity as well, as we have a high prevalence of obesity here in the valley. Hypertensives, we do also get a lot of hypotensives, which is very different when we work with them. You know, it's very well in general. All these patients are very difficult and somewhat tedious to work with, just because they're very limited into what they can do. These patients, you know, the a goal for some of these patients is, you know, just to get up and sit on the edge of the bed. In best case scenario, we take a lap around the floor. Like, it's very limited. That's why I do enjoy the inpatient rehab better, um, or enjoy it more. All right, so I've kind of been rambling, and all of this information can probably fit into these next sections, but I think it fits just fine. You know, okay, so what made me want to pursue my degree? So my degree is exercise science. I do have a concentration in physical therapy. Um, so that's why I am doing all these things. I also am involved with other clubs in school. I'm involved with the Exercise Science Club, the PPT Society, and also SOIC, the Special Olympics Inclusion College Club. I try my best to attend these SOIC events. It's just that it just so happens that every SOIC event is very early on during the day, and it's very difficult for me to attend that because I have so many other things going on, whether it's school or obviously work, which is where I get my experience. I have also done shadowing in the past, but as I've learned, it helps so much. It's such an immense difference when you get paid for your experience, which is what I consider this what I'm doing right now, versus, you know, just going into shadow. Um, well, I'm just gonna add this. So like at the end of this semester, I am planning to switch the pediatrics job to a different outpatient setting or something of that manner, just so I could get further my experience even more, as opposed to just keeping the pediatrics clinic, because I wouldn't say I'm the biggest fan of the pediatrics side of therapy or in general. But yeah, that's basically my experience as a technician. Okay, so back to the topic. What made me want to pursue this degree? Exercise science with concentration in physical therapy. So this is like getting asked, why do you want to do physical therapy? So for me, physical therapy is something that I have been locked into for quite some time now, and it's always something that I knew I wanted to do since high school, but I didn't have the discipline or the knowledge to know where to even start or how to even get to the position that I'm in right now. It was honestly very challenging to get where I am now. So everything, my life has shifted immensely compared to even 2 years ago. Since then, my life has been physical therapy and pursuing everything possible and doing everything in my power to make sure I get into any DPT program that I want to. Um, you know, whether I also am doing a research internship with Dr. Yu at school, um, with the Health and Human Performance Department and the Student Health and Success Initiative. You know, sometimes we do little presentations to high schoolers or even faculty members of the university. So going back to why I wanted to choose this career path, it's, you know, as every, you know, son or child or a daughter sees in their parents is their degeneration and, you know, the old age gaining up on them. I, as a son who witnessed his dad beat colon cancer, I've seen the negative effects that has had on his body, and I see all the positive effects from exercise and from physical therapy in the experience that I've acquired to see how this to see how those factors can, you know, slow the degeneration of the body further and even help regenerate some functional capacity. So yeah, I would say physical therapy just absolutely completes me. It's who I am. I wouldn't know what I would be doing without it. I honestly don't know, because I had also been thinking about going to PA, physician assistant. However, what I had seen amongst physician assistants, nurses, or even MDs is that these other professionals, they're awesome, right? But their patient to patient communication and experience, and their like um the connections they build within them aren't necessarily the strongest or the most in depth, which is something I did see with physical therapy. You know, with physical therapy, you have to convince the patient to actually get up and do the therapy, because a lot of the times they are very unmotivated. They do not want to get up. They're kind of just like giving up essentially. So a lot of the yeah, a lot of that's a lot of what I see with physical therapy. You have to build rapport with the patient, you know, add in humor, um, motivate them to get better. I feel like that's a big aspect of wanting to help people that people don't take into consideration. So yeah. All right. So what do I plan to do with my degree? Obviously, I need my exercise. I need a degree. I don't necessarily need exercise science, but exercise science plays in very well with physical therapy, because in exercise science, we learn all about exercise and stress on the body. I like to consider exercise science anatomy and physiology with stress added to it, or with exercise as a major as a whole. So just with exercise science alone, I've made so many connections, like with the information and the curriculums from the certain classes in exercise science with real life experiences that I've seen in the hospital. Um, so yeah, obviously I need my degree to apply to PT schools. So I will be applying next cycle, even though I won't be graduated yet. But what they count is as long as you have your bachelor's before your program starts. So you can apply a year in advance, and as long as you graduate within that year, and you can start the program within after that, like once the year begins. Sorry. So yeah, obviously I plan to pursue physical therapy. I've kind of mentioned a lot of the steps that I plan to take, a lot of the steps I'm doing right now. I guess something else I would like to add is that for my, or I would really, I'm really interested in neurology and neuro for physical therapy as a specialty. And I've decided that for my internship capstone for my exercise science degree, I'm going to want to do my internship at the Neurotherapy Institute with DHR. I know a couple of PTAs, physical therapy assistants, that can get me in. These are connections that I've made from previous shadowing experiences and even had them in classes before. So networking is also a very important deal in anything that you do. Um, so yeah, I'd really love the opportunity to do that. I will be planning to do that this summer. So there's that. What can I do starting now to get to where I want to go? I would say that I've already answered that. I would say the same thing that I kind of already said. Honestly, I would just continue with what I'm doing right now. I kind of already explained what my future plans are, considering my furthering my experience, um, and what I'm kind of doing in research. I guess I'll go ahead and explain what I'm gonna do in research. So, well, right now, I did explain that we do those um, presentations to schools and pre-college students. But one thing that we did just recently is we submitted some proposals for research, and my proposal had to do with the EMG, the electromyography, which basically measures the muscles contracting in certain it basically measures the amount of motor units being used at a time. And it shows on a little screen, like let's say you have the EMG right here, and you contract a little bit, the line will go up a little bit, or the muscle contraction, the electro stimulation will go up a little bit. And if you contract harder, obviously there's more stimulation in the muscle, so it'll show a little bit more. The line or the graph, whatever, will go up. So basically I'm gonna be assessing that in different in different appendage lengths, from the hip to the knee, and then the knee to the ankle. Obviously people are all different, they're gonna have different leverages. So what I'm trying to see is how do the different limb lengths, lower limb lengths, affect muscle contraction. Like, is someone who's super short with a short ankle to knee and a short knee to hip going to have a different amount of stimulus in their quads and glutes compared to, I don't know, a super tall athlete who has long lengths in both of them, in both knee to ankle, or knee to ankle and knee to hip. Something else that I'm going to be looking into, there's people as well with a very long femur and short tibias and fibulas. So it'd be pretty cool to see something like that as well, and compare the difference to someone who with longer tibias and fibulas to a short femur, which is, I don't know. There's still a lot more to look into, but however, this is again just a proposal. We're not sure if it's going to be accepted or not, but hopefully it is, so we can focus on that as well. Advice for my future self. How can my instructor help me get there? How can Dr. Benavides help me get there? Advice for my future self. Well, for right now, I can tell you that my future self is cooked. I'm just kidding, guys. My future self has a lot in store for him. Next semester, I will be taking 19 hours. I will be doing my internship capstone in summer 1 along with another class. I will be taking another class or 2 in summer 2. And then the rest of my classes that I need to graduate, I will be taking in fall 2026, so that I can have a semester off before I start any DPT program that I get into, hopefully get accepted into. So advice for myself, I would say take everything one step at a time, which is kind of what I'm doing right now. Take it day by day. Get individual things done at once, which is also kind of what I'm doing right now. This is the time period that I have to complete this assignment, this project. Yeah, I mean, I'd say that that's about it. I think I'm about over a good 15 minutes right now. I hope I checked all the boxes. Dr. Benavides, if you see this, please give me some feedback on what you think. How can my instructor help me? Dr. Benavides, I know that you are involved with one of the last SOIC meetings, so I guess just be there for me if I ever need to reach out to you. I probably will at some point, just to ask you how can I become a better applicant in a DPT program, or maybe a future mock interview from you. That would be pretty awesome. Yeah, well, thank you to whoever's listening to this. That's about the project.